Hello, this is Kuldeep Chaudhary reporting from Health in India. I'm at Aarvy Hospital, Gurgaon, and this is 2nd of February 2012. We have a patient over here who's come from Nigeria, Ms. Tolulu, accompanied by her husband, Olukunle. They had come here for a GI surgery. This was basically a surgery for the removal of cysts from the ovaries. One fine morning, Tolulu felt some severe pain in the abdomen and she was rushed to a hospital in Lagos, Nigeria, where she was diagnosed to have acute appendicitis. The surgeons took her into the operating room, and while doing the surgery, they discovered a ruptured cyst. After her discharge from the hospital, her gynecologist advised her to take care of this cyst. This was about 2 years after they had been married and they had not seriously tried for getting pregnancy. Later on the advice of the gynecologist, they were trying to get the pregnancy, but the cyst kept on growing within the ovaries, and finally the gynecologist had to advise for them to go for a procedure called oophorectomy, which is the removal of the ovaries. This would have meant the end of their dream about pregnancy and having children of their own. The computer engineer husband, Olukunle, decided not to give up. He went on the internet and searched about the best possible treatment for this kind of condition. They came to know about this procedure being done routinely in India, and he got in touch with the team of experts at Health in India who advised him that several good doctors and hospitals are doing this procedure. On finding about the various costs, which were again very much different across various hospitals, they decided to choose Dr. Vikram Yadav at Aarvy Hospital to do this procedure. On the morning of 29th, on a very chilly Indian winter, they landed at the Indira Gandhi International Airport. Straight away they headed for the doctor's consultation, who advised them to go for an whole abdomen MRI, which was done at Modern Diagnostics. The MRI confirmed the reports which were given from Nigeria. The ovaries were full of fibroids. So Dr. Vikram decided to do the surgery the very next day, and on the 31st of January at 8 o'clock in the morning, she was successfully operated in a procedure which lasted for about a couple of hours. The ovaries were cleared of all the cysts, and in addition, hysteroscopy was done to remove the blockages from the fallopian tubes. Let us now talk to the patient and a delighted husband, who not only saved a lot of money by choosing Aarvy Hospital for their surgical procedure, but are on their last day in the hospital. Tomorrow morning, Tolulu is going to get discharged, and in the next 5 days, the stitches are going to be removed, and they plan to fly back home on the 12th of this month. I'm with Olukunle and Tolulu from Nigeria. Hello to both of you.
Hi.
It's your third day at the hospital and you seem pretty much relaxed after the first 2 days. So Tolulu, how are you feeling now?
I feel better. Although I had this week in the morning, doctors came out with some drugs and fine.
So you've been on liquid diet since the day of the surgery?
No, yesterday.
Yesterday you ate some
Yesterday
solid. Okay.
No, liquid.
Only liquid?
Yes.
You haven't had anything solid. So that is probably the reason why you're feeling a little bit weak.
Yeah,
But otherwise, how do you feel? You've been through one surgery before. This is your second surgery. Do you feel any kind of difference?
Yes, I did. Funny enough, the cuts was on the same place where I had the former one. By the second day of this one, I was already starting sitting down, moving. But the first one that I had, I think I spent like 3 days on the bed. I couldn't move. And this, I didn't feel any pain except rest. But the other one, the first one that I had, the pain was terrible.
Okay, so now when you're moving and going to the washroom and all, so you don't feel any pain?
It's amazing. I'm wondering what they did
Okay.
I don't know what they did because the other one, even on the fourth day that I tried to go to the hospital, to the washroom, it was painful. It was a painful experience. But this one, second day, I was already going to the toilet, which is good.
Okay, so this surgery was done under general anesthesia. Do you remember anything of the operating room or inside of the operation theater?
Before the operation, yes.
Before the
During
operation?
the operation, nothing. After the operation, nothing. I just remember when I came into the room and I was asking for the doctor.
Yeah. And I remember that on the day of the surgery, when we left the guest house at about 6:30 to come to the hospital, you were absolutely quiet during the entire route. Were you anxious?
I had the, let me use the word, the trauma from the previous operation, the pain, the nausea, everything, and I would feel the same thing. So I was just within myself thinking, God, and your arms. I was anxious, yes.
But you are still a very courageous person to undergo 2 surgeries, hoping to have a child of your own.
Yeah.
How much confident you are now that that dream of yours is going to be fulfilled sooner than later?
Well, looking at the way the parts of my body that was from my stomach that was operated on, looking at the way it's looking, it's a bit different from the other one that I had earlier. And from the way Dr. Vikram's been talking about cleaning the fallopian tubes, it seems more like he did more than he actually expected. He did more than just removing the cyst. He cleaned the fallopian tubes, and I'm confident that
Okay, now Olukunle, when you got in touch with Health in India for the first time and you were given quotes about 2 hospitals, and there was a huge difference, there was about $2,300 US difference. When you chose the cheaper option, were you at any point worried that you are not taking the quality decision?
Well, I would say yes and no. Yes, in the sense that when you see the difference in the numbers, in the figures, you wonder, okay, why is this cheaper, why is this more expensive? And no, in the sense that I was confident in the consultancy services, believing that I won't be taken to somewhere that is not good enough for the procedure. So, but more of no, I wasn't concerned.
Okay. Since you have, most of the people would not be so computer savvy as you are, you're a computer engineer yourself. How much role did the internet play, first in your choice of the treatment, and then second in assuring yourself that the thing that you're choosing is good quality?
Okay, on a scale of 1 to 10, I would say 9.
Wonderful. What else can I expect from a computer person to put?
And also, it also helped because before we got in touch with Health in India, and I think I was rushed to the hospital sometime in November 2011, and the pain was just too much. So when I came back, he was not around. When I came back, I just went on to the next. We were talking about coming to India, so I searched gynecologists, Ovarian surgeons in India, and I got some names. Then I got Health in India, and when we got in touch with you, you gave me 3 names: Dr. Vikram, Dr. Kapila, Tennis. I can't remember the 3rd doctor. And funny enough, the 2 names I got, some of the names I got earlier, I got Dr. Vikram's name and Dr. Kapila's name. So I downloaded their profile, and when you gave the 2 names as well, we were kind of confident that most definitely these are the 2 doctors that are very good at doing these things. So the internet played a very good role, major role in informing our decision. We've actually searched, I actually have their profile and their pictures on my phone because I took the pictures, I downloaded the profile of the two doctors. That okay, this so that we see this doctor or we see that doctor. And I read a lot about Dr. Vikram, so I was confident that I would go for him.
And that's why she was asking for him after the operation.
Yes, and in fact I could sense that because when we were driving towards the hospital, on the first day I could feel that you know a lot more about the doctor and the hospital, and of course internet would have definitely done that. We advise almost all our clients to take a decision about a surgery or the doctor once they're sitting in the doctor's chamber. So when you met the doctor for the first time, what did he give you that kind of confidence that the procedure is well within his control?
I wasn't surprised when he was talking. I was just, whatever you say, I'm going with Dr. Vikram. So he gave the confidence, yes.
Okay. And what about the other services at the hospital? Of course, it is not a 5-star hospital.
Yeah.
From the medical perspective, how do you find the services?
Very interesting. I've made so many friends.
Okay.
I've made friends, and it's amazing the way they come in, like every 10, 15 minutes. Though we can't communicate very well because of the language barrier, but you could feel that they have empathy.
The hospitality.
The hospitality.
So they
connect
communicate
with you. Even the ones that couldn't speak English. There is one that comes and she can't speak English, but she just keeps talking, asking, and then we try to meet at a point, and there's that connection with everybody.
So mostly they communicate through smile.
Yes. Yes.
And how about the other things like food and all? You've been ordering food from outside, so have you been getting the kind of food that you were looking for?
Yes, I'm actually used to the Indian spices because I've been here before, so I enjoy the food, but she hasn't been able to eat after the operation.
So this is your first visit to India.
Yes.
What, apart from, of course, a good medical treatment, what is your take on India as a country?
I think the people are warm. They are welcoming. The few people that I've met, they look at you and they're like, you use a foreigner, but they smile, And even people in your office, your staff, and everybody. I was blown away when we had lunch, and everybody had lunch together. That was amazing. That was nice. So, and then the environment is I feel safe. The environment is welcoming. It's cold compared to Nigeria. It's cold.
Yeah, this year the winter is pretty severe.
Yeah.
So.
But yes, India is Gurgaon is beautiful. Very beautiful, and the people are warm.
So today is your second day at the hospital. Tomorrow morning, most probably, you're going to get discharged. You still have about 9 days in India. So what are your plans?
I plan to go out. I plan to go out.
I plan she's going to rest in the hotel.
Okay.
And get well, get strong enough, remove the stitches, and then if there's time left, we can go out.
See more.
And I could see some books lying behind me. So your studious husband, it seems, has brought books as his companion to India also.
Yes, because he wants to write SAP exams.
Okay.
Yes.
So Olukunle, best of luck for your exams.
Thank you very much.
And Tolulu, we wish you complete health.
Thank you.
And we want to see you as a proud and beaming mother very, very soon.
Yes.
Thank you very much.
Thank you.